I think that's an excellent question. First of all, even survivorships of 2 months are meaningful to people with pancreatic cancer who many times have quite limited life expectancies. But even more than that, not only was quantity of life improved, quality of life was improved as well, especially with respect to freedom from pain progression. And when you're dealing with a condition in which you're not focused so much on a permanent cure, but on maximizing quality and quantity of life, seeing improvement in both of those dimensions are important. So I think this is a very significant finding. I think the differences are quite meaningful to patients, and I think patients would be anxious to receive them. But more than that, Tumor Treating Fields has a potential to synergize with a variety of different cancer therapeutics on the horizon. So I would view the results of the PANOVA-3 trial really as a first step, a kind of a stepping stone to much bigger and even better results when the therapy is expanded to other indications and used with other agents. Now, you also asked me about progression-free survival. It's important to point out that, first of all, there was an improvement in distant progression-free survival that was seen, which is quite significant, but it implies that the device is having a positive effect on the emergence of cancer outside the region of the pancreas itself. There was a trend towards improvement in progression and local progression-free survival, but it was not statistically significant. And I think there's a good chance that the reason for that is that CT scans are poor at assessing tumor response in the pancreas. They're very good at showing tumor progression, but poor at showing tumor response. And I'm guessing there was a much bigger effect on the local cancer than was reflected by the CT scan. And so finally, I would say that patients, again, from their point of view, are concerned about quality and quantity of life. They're not really concerned about the specifics of disease progression. So I think that the progression-free data can be explained in other ways and doesn't interfere with the significance of the findings. I would say to this question, there's a three-part answer. First of all, as I said previously, I'm not sure that there wasn't a favorable effect on local disease control and progression. I think it's just that the tool used, the CT scan, didn't adequately show it. The second part of the answer is in terms of telling us how the device might work. It clearly indicates it has some effect away from the cancer itself that maybe was to some extent unanticipated. And the current theory is that the most likely explanation for this is that tumor treating fields are activating the immune system to fight against micrometastatic disease elsewhere. And I would conclude by saying that for every stage of pancreatic cancer, from cancers that are immediately resectable to those that are far advanced, what has produced the improvements in overall survival that we have seen has been controlling the disease systemically throughout your body as opposed to just in the local site. So these observations just reinforce that. Well, I would answer thusly. In this particular stage of pancreatic cancer, FOLFIRINOX has not been shown to be clearly superior to gemcitabine and Abraxane. Furthermore, there are plans afoot to test the tumor treating fields with FOLFIRINOX. There are some patients for whom Abraxane, even excluding the consideration of tumor treating fields, is preferable. Likewise for FOLFIRINOX. There doesn't seem to be a major survival advantage between the two. And again, plans are being made to develop use of the device using both types of chemotherapy regimens. I would add that there is another PANOVA trial called PANOVA-4, which is going on right now, which tries to expand understanding about this effect that tumor treating fields has on distant disease sites, presumably through stimulation of the immune system. So in the PANOVA-3 trial, the same treatment, gemcitabine, Nab-Paclitaxel, and tumor treating fields, is being used along with an immunotherapy, atezolizumab, a checkpoint inhibitor. And the hope is that this will provide clinical basis and evidence to support the theory that tumor treating fields does have this effect on cancer immunity. And if that study proves to be useful, then it will certainly expand interest in the use of tumor treating fields beyond local disease to metastatic disease.